Hi, welcome back to MassageWise. This is part 2 of my client bootcamp. Now, first we went over licensing in the other video and what makes an establishment legal. So, part 2 is what to expect, because a lot of these YouTube stories that I'm hearing typically have it where this person supposedly gets a lot of massage therapy done, but doesn't seem to understand that there are some things that kind of go unsaid. But then again, that could be because I am a therapist and I'm on the other side of the coin. So today's video is going to be what to expect. Okay, you go to a massage establishment. I'm just going to call them an establishment because there's a lot of places that call themselves retreats. They call themselves spas. You know, this place might be part of a chiropractic practice, but these are legal places that have massage therapy. So if you're going to a massage therapist, period, you're going to have to fill out an intake form. And I'm going to show you a picture of it. And so like I said, there's a sample picture of an intake form. And you will have to fill one out for a legal establishment. If they don't have you fill one out, ask if they have them. And if they don't have them, that's a industry no-no. They have to have these. These are for legal purposes to prove that you were even there. Because say you have a bad encounter. Let's say that there's misconduct done. And you're trying to take this to court. The intake form proves that you were there, that you had a service provided, rather than you saying, well, so-and-so did this, and they're like, well, we have no records of them being here. There was no paperwork filled out. It's a he said, she said, with them having no paperwork that you were there, and it's the industry standard. You need to fill out a paperwork. Next would be, you know, a lot of the times, some of them are kind of creeped out, but we want to have ambiance in our environments. It's an environment where we're supposed to be encouraging relaxation, calmness, tranquility. So they're not going to be talking very loud. They might be whispering even. You should, in many of these establishments, hear some background music. You might, if you get there early, if you follow the steps from my previous video and you get there 15 minutes early, and this is one of those really blessed establishments that have that wonderful massage therapy meditation room that you can take advantage of, feel free to take advantage of that. Your therapist, 9 times out of 10, it is starting to be more of a trend where you have either a specific uniform with like a polo shirt and like black khakis, or some of them are going to scrubs, which I'm going to be completely honest, I hate scrubs. I'd rather wear the khakis. I mean, heck, I can do massage therapy in blue jeans, for crying out loud. So at this point, you filled out your paperwork, you're prepping for the session. The therapist comes, they call your name, and they either guide you back, like you're following them, or if you're with me, I start my assessment when I pick you up. I encourage you to walk in front of me. I watch how you walk. I watch such things like your gait, like how you walk, what speed you walk, what muscular groups in your back are affected, what your footwork is. And a lot of people who've taken band know that there's certain different ways you walk for performances, or if you do a lot of other specific things for schools or military. You can see this in how a client walks. And so if the client is walking in front of me, I can see this. But if a therapist decides to walk in front of you and lead you to your room, that's still okay. This isn't an industry thing. It's more of a therapist's personal choice thing. I like to see what I'm dealing with. When you get into the room, this is how massage therapy time works. Okay, let's say in this scenario, you purchased 60 minutes. So you purchased an hour of massage therapy. 99.99999% of the time, this is how it works. So we get into the room. The first 5 minutes is an intake interview. So we're establishing what this specific specific session is for. Now, you might normally come for relaxation because you've got like a retail job or a fast food job or something that's very stressful. However, in this scenario, something happened at work, or you do typing and something is built up to the point where it's causing pain, like you have pain in your neck. You tell me about this pain, I look at your intake form, I see what your profession is, and if I am a self-respecting therapist, I understand that this particular vocation has prevalences to do X, Y, and Z. I know this from looking at your paperwork, but you're giving me this feedback. So you're telling me where it hurts, how long it's been hurting. Most of the time, we're trying not to spend too much time in there because, like I said, it's 5 minutes. First 5 minutes is this intake. So we come to an agreement, okay, what areas of the body you're okay with me having contact with. Some people are kind of irked, like if they have low back pain, they're like, but why do you want to work on my glutes? Well, because it's going to help fix the problem. Or muscle tension is so tight in the back when we palpate, and palpate is kind of like just like gentle pressure trying to feel what those muscular structures are telling us. Intake, 5 minutes, we find out what the session's going to be for, what areas you're okay with contact, what areas you're not okay with contact. I ask the question if you're ticklish, because there's techniques that can be utilized for ticklish areas where we're not triggering the ticklish sensation. So, as the therapist, I will leave the room, and I'll give you about 3 to 4 minutes to get, naked under the table, draping, plausibly not naked. Most of the time, I actually prefer if you keep your undies on. If you keep your brassiere on, I'm not going to work under your brassiere. You keep your socks on, I'm not working on your socks. Your underwear, however, is just like working through the drape. Don't care. If you want to keep your shirt on, okay, I'm just going to work with what's not covered because I don't want to give you rug burn from a shirt. But if you have to build up to that with trust with a therapist, it's something that is what it is. Now, the areas of the body that's typically worked, and I know this because every school plausibly does the same sequence. When you're learning how to do Swedish massage, which 90% of the states that have licensure, if not 100% of them, demand that you know all these programs are so that you are certified in Swedish massage. You're going to start with the back. Now, the back, depending on how people deem it, can go from your shoulders to where your spinal column meets the pelvic bones. That's the back. Typically, it goes back, both arms, and we do arms in the back and then arms in the front on different sides. So we'll do the back of the arms. We'll plausibly do the hands where you have your palms up. We'll do neck. And then you cover the upper body. And then it's each individual leg, followed by, if you have given permission, a gluteal massage. Now, like I said before, some therapists will expose small portions of the gluteus to work on it directly. I don't like to do that. It's just wasting time because I have to sit there and pull the drape back, work on you, pull the drape back down, cover you up. I'd rather just work on you through the drape and just get it all done. Then work on the feet because you're face down and I have your bottoms of your feet that I can work. After that, we cover the feet, and I'll pin the table draping down, the sheet, and I will, kind of, if you're asleep, I'll kind of wake you up a little bit and say, okay, we need you to turn over onto your back, please, where you will slightly scoot down the table and flip over onto your back. Now, if you turn towards your therapist and where they have the draping pinned, 9 times out of 10, male or female, we don't want to give off any idea that we're looking at you. Most of us will be like looking off to the side, or looking up this way, or looking up that way. We're not looking at you. And most of the time, we like to keep the drape kind of like pulled up in front of us so we can't see anything anyways, because you're going to be scooting down. So we'll get you onto your back. Again, we'll work on both arms, only the front of the arms. Both legs. We'll plausibly work on your feet again. We'll work on scalp and face. And with some aid, we can work on the chest. Small portions of the chest. Like, I'm going to just move this here for this. So, let's say you're a female, and I have to work on your pecs because your shoulders kind of like doing this thing, where it's like, you're starting to become the old lady. And so we have to stretch out this pectoral muscle. What I will do as a therapist is, first and foremost, depending on how big your breasts are, you're allowed to work kind of like this small section here, right above the breast tissue, around the collarbone. It's just, I think if I'm remembering from school where they actually called it something, it was a décolletage. However, if I have to work on tissue below that line, what I have you do is I have you grab your own boob, kind of like this, and I have you push it down. So I'm not touching your boobie, but I am working the tissue underneath your boobie. So technically I'm not touching your boobie, I'm touching the tissue underneath. So, let me fix this. For guys, it's not the same thing. If your shoulders are tilted forward, I will bring this up beforehand. You will have some warning on that fact of, okay, we're going to be working on your pecs. And personally, I don't care if you're a fuzzy guy. I honestly have no consideration whether you are smooth, like just waxed, kind of newborn baby smooth, which kind of creeps me out, or if you're a beaver. Don't care. I'm a therapist. I'm there to work on your muscular structures. I'm not there to be sexually attracted to you. You are a client. A client is like, I take my sex drive and I lock it in my closet or my locker at work. That's where my sex drive goes. I am 100% trying to be professional. And this is what every self-respecting male or female therapist, we take our sex drive and we lock it in our locker. We're not there to be attracted to you. We're there for a therapeutic purpose that has a mechanical and biological result. You relax, those muscles stop hurting. The surgery that your body's not healing from, like if you have hip surgery or shoulder surgery, and it didn't heal right and your rotation isn't working because those muscles are just too tight and you didn't get the healing the same way. We're there to help. We're not there to be amorous. And another thing that some therapists may or may not do, and this kind of can differ therapist to therapist or establishment to establishment. There are some establishments where they let them kind of have free reign on doing this or not. Like I mentioned in a previous video, in the summertime, when I know lotion isn't going to be absorbed too quickly because I know that the feet are sweating, some places kind of get around this by wiping your feet off with a hot towel, where the lotion or oil or gel or whatever medium that particular establishment's using gets wiped off with heat and your feet dry quickly. Some therapists prefer, once they're done with an area and they have free reign to do this with the establishment, some of them won't let this, some of them will, they may take a hot towel and wipe down the limb. Like they'll work on your back and then they take a hot towel and just wipe your back down, so they're collecting the oil. They'll work on your arm and likewise wipe it off. They may or may not do that. Just warning you, I know some of my coworkers did that. I know I, for a while, did that when I was working at my last job. So, you should not have a therapist that works on your breasts without you either specifically asking for it or you helping, such as I just demonstrated. Male or female, that's kind of the standard that I have been taught through multiple continuing education classes. There should be nobody that's feeling up on your breasts without it being mentioned first specifically, and or a waiver being signed, because as a massage therapist, we're not supposed to work on breast tissue. We're supposed to work on muscular structure. So like I showed with the demonstration, that is to get to the pectoral major underneath the breast tissue. If you are a guy and they're working on your pectorals and your shoulder isn't curving forward, or they didn't bring it up, they are either not trained the way I've been trained. And I've done a lot of continuing education classes. I've worked with a lot of people who've been in the industry for 12, 13 years, and I've done couple of sessions with them, and I've periodically looked over and observed them, and they don't do that. Scalp massage can be kind of tricky. I've seen some of these YouTube videos where they're like, why are they getting all up in my hair? Well, first and foremost, if they're messing with your hair, they should have no oil. The establishment I worked at, I'm not going to name it, I respect it highly, but I just don't have the legal, I don't feel legally like I should right now. I might get permission, but probably not. If you're working on the hair, or if you're working on the face, you have to put sanitizer on your hands. Basically, your hands have to be clean. If you're working on the scalp, so that's like from here, like all the way up in here, kind of thing, your hands are dry and you've used sanitizer. Basically, you're not doing a lot of these like strokes. What you're doing is kind of like this. If you can imagine like Adam's Family thing on Gomez's head, that's kind of what scalp massage is. On the face, you don't use oils. Typically, you don't use a lot of deep pressure either. As far as I've been led to believe, massage therapists don't do anything on your eyeballs. Like cold stones that I've been trained, it's this tissue right here, and or like we're going over this large muscular structure that attaches to your mandible. We can do massage on your face with fingers. I have Kansa wands that I work with, and so that Kansa wand needs to be clean. And when the process is done, you're probably going to have a hot towel, to wash your face off. With cold stones, it's like little itty bitty stones. I actually think I have one. Give me a minute. Okay, yes, I do have one. So it looks like this. It's not too big. And like I said, typically it goes like right here. Nothing should go up here. Like you see, nothing should go up there. Typically, from what I've been trained, it goes right here on the muscular structure. And you can use it in a circular form to go on the jaw, to go across the forehead, maybe onto the nose, kind of like makeup, on your jaw piece here, stuff like that. Stones will do that. Typically, you're going to have some things where it gets a little weird. You might not be used to a foot scrub, or you might not be, if this is your first time getting a foot scrub, you might be kind of like weirded out by somebody else touching your feet. From what I've seen with some people, they kind of like the tail end of it a little better because the beginning can be a little vigorous. You're using a scrub to try and encourage, dead skin to come off, and you're being vigorous with it. Not a lot of people can stay in the happy zen moment when something vigorously is just jerking the foot around a little bit. You're probably going to be face up if you're there for the standardized session, and if somebody does the sequence, like I said, I just call it the sequence because it's the stuff they teach us in school. At the end of the sequence, there should be an approximation of 5 minutes left on the clock. And this is for you to collect your wits, get yourself off the table, get yourself dressed, because in a professional setting, somebody is going to be scheduled behind you. So 5 minutes before for the intake, 5 minutes before the ending for you to get dressed, so that they have an approximation of like 4 to 5 minutes to what's called flip the room. So just so you know, flipping the room means that the table linens that were used on you, the fitted sheet, the top sheet, the head cradle, those are stripped off. Okay, because they had direct contact with your body. And so a fresh head cradle, fresh fitted sheet, fresh top sheet should be put on. Those are things that are going to have direct contact with your skin, whether you're wearing your boxers or if you're just commandoing it. Those things for every client should be, clean. And I know you probably knew this in your back of your head. I'm just giving you reassurance. This is what you should expect. Under no circumstances, and I've heard this in some of these stories, under no circumstances is your therapist going to leave the room while your time is still there. Like, they're not going to be like 15 minutes in and be like, oh, wait, yeah, I got to go do something. No. The only time that's going to happen is, let's say, they're fully booked for the day, and they thought they had enough hot towels to use on the clientele to get them, let's say, to lunch. To their meal break. Maybe they underestimated it and they have to go get 2 hot towels. It should take maybe 4 or 5 minutes for them to go set up the towels and bring them back. And unless it's mentioned beforehand, because I have done this a sum total of once in my entire career, once in my whole career, where you traded out with somebody else. I traded out with another therapist because my client showed up late and I was fully booked for the day. I only had enough time on the clock for half of her session that she was originally scheduled with me for, and then I traded off with another therapist. The client was made aware of this, the therapist, both of us were made aware of this, and the retreat director was fully aware of this. Everybody was in the know. Everybody knew what to expect, and the trade-off was done seamlessly. The client got what they wanted. Both of us were compensated for our work, and things were fine. You're not going to be left alone for a very, very long time because you're paying for that time. And if you're paying for the time, short of it being 5 minutes before for the intake and 5 minutes before the end of it for you to get dressed, you should be getting that hands-on time. So like I explained, 10 minutes for getting undressed and intake, and then redressed at the end. So if you're paying for 60, you're getting 50. But that's 50 minutes of hands-on. And if you followed my suggestions and you're there 15 minutes early and you're already in a state of relaxation, you're not going to even care. You're going to be in happy Zen land within 5 to 10 minutes. Deep into that, sawing logs on like the massage therapy table kind of happy. So there's that which you should expect. You should go in, fill the intake form out. The typical massage works on those particular body parts that I listed. You can always say no to a gluteal massage or a foot massage or a scalp massage or a face massage, because I've had some clients, I don't know why, but they come in right after a hair appointment or a makeup appointment, and so my headdress is going to get makeup and eyeliner and all kinds of stuff on it. Just is what it is. But that is part 2 of Massage Therapy Bootcamp. And like I said beforehand, if there's a topic that you'd like to have me cover, or a question as a massage therapist that you, the consumer, would like me to answer, make sure that you leave a comment down in the comments section. Please hit the subscribe button and the bell so when I put up new videos, you'll be one of the first people to know. So enjoy your day and check out my other videos.